Okay. Spend time with it. Love it. The more time that you spend with it becomes an addiction. I kid you not. Okay. And as far as malnutrition is concerned, I've color-coded it for you. We have developing countries in red, approximately 27%, less than 5 years, suffer from protein energy malnutrition. By the way, marasmus and kwashiorkor both come under PEM, protein energy malnutrition. Okay, which one is dealing with protein? Kwashiorkor, yeah. Marasmus, complete malnutrition. Good. Sub-Saharan, 30% of children have PEM. 50% of young children living in South Asia have PEM, protein energy malnutrition. Okay, so that can either be from marasmus or that can be from kwashiorkor. And then in the U.S., of course, we don't have this so much. Every once in a while, more or less, dealing with ignorance. Okay. Now, when you do your pediatric rotation, you'll deal with graphs like this. Okay, you're dealing with your basal metabolic index. Important, extremely important. First of all, when you're looking at the sheet, please make sure that you know that you're either dealing with a boy or a girl, all right? Because it's quite different. It's just simple stuff like that, so make sure that you read. What I'm trying to say is if you take a look at the top right box, it's a 2 to 20-year-old boy. And so for that, you can calculate the height and the weight, and depending as to what's going on, you'll figure out as to whether or not this particular child is developing properly. Okay? Nothing much more. So here, I alluded to this a little bit. Somatic. If I say somatic, what particular malnutrition are we speaking of? Marasmus? I hear marasmus, and that is the correct answer. Yeah. If it's visceral, so therefore, process of elimination, which one do we have left? Visceral, dealing with your organs, dealing with protein, and that'll be kwashiorkor. And so if you lose your proteins, what kind of liver are you going to have? Hepatomegaly. And then we'll see a bunch of other signs and symptoms. We'll talk about the hair, we'll talk about the skin. Okay. And what kind of edema? Pitting edema? Well, in general, you're going to have edema with kwashiorkor. You're not going to have it with marasmus. So here, classification, the only thing that I will hold you responsible for will be kwashiorkor plus edema. You know as to why. Less than 60 to 80% of expected body weight, and marasmus. Once again, you know why we do not see edema. No need to memorize this. You understand this. Does everyone understand this? Oh, by the way, as far as visceral, so how would you go about measuring this? Because if it's somatic, you can do circumference, you can do tape measure, so on and so forth. But if it's going to be visceral, it's rather difficult because it's going to spare the somatic compartment because you're looking at more protein loss, which is coming from the organs. So how are you going to measure that protein? You check for ceruloplasmin levels, transferrin levels, albumin levels, right? Things that you've heard of. Those are all proteins. And that'll be for kwashiorkor, visceral compartment. So if this was mid-upper arm circumference, which one are we talking about? Which malnutrition? Which PEM? Marasmus. Very good. Okay. So usually it's less than about, looking at less than 110 depending as to whether or not you're having complications. This is just for your reference. There's nothing testable here. All right, so now let's take a look at marasmus. So we said that it's catabolism of your somatic compartment. The subcutaneous fat is mobilized. Subcutaneous fat. Broomstick appearance. Look how skinny that arm is. Unbelievable. Some of these pictures, it's even to think that it's even real, but yet it's out there. And as I said, the visceral compartment will be depleted. However, it'll still be spared, right? Pictures of marasmus. Extremely skinny to the point where you want to kind of faint. All right, so let's go into kwashiorkor. Kwashiorkor, protein loss. Ga. What is Ga? Language of Ghana. Where's Ghana? Africa. Yeah. And what it means is basically, interesting enough, was that a disease of the second born, meaning that you have a first child, you have a second child, and the first child ends up being prematurely weaned. In other words, gets neglected. Okay, so this is a problem of neglection. Yes, sir. Well, cachexia, once again, you're looking at malnutrition, and then it's in a case back home. It'll be in the U.S. It'll be more a patient who has cancer or whatnot, and so it depends on the circumstance. So if you actually take a look at the definition of cachexia, and that's why I didn't want to bring it up, because the spectrum here will be between kwashiorkor and marasmus. Okay. No, because that'll be difficult. Yeah, you're right. You're right. Because cachexia, once again, you're looking at a patient who's extremely withdrawn, very skinny, scrawny. Yeah. You'll have to take a history. It's another thing too. You can't put two and two together on my exams or on my test questions as well. You'll have a picture. You'll have a stem. Read the stem. See as to whether or not it correlates. Okay. There are things that are not exactly textbook, and it's up to you so that you can differentiate, so that you can put the big picture together. That is the point of all this. All right. So protein deprivation, as commonly seen in Southeast Asian children. Children are prematurely weaned due to the arrival of a second child, GA, and are subsequently fed an exclusively carb diet. You can have, what do we say, protein loss. So where else would you see protein loss? Chronic diarrhea, nephrotic syndrome, the burns. There are the burns again. And in the U.S., more or less, it'll be fad diets. What's a fad diet? Something that's so incredibly popular, but is it necessarily good for you? No, not at all. Okay, so you have to be careful with that. Everything in moderation, especially being in this field of medicine, that's something that you need to emphasize with your patients. Allow them to open up to you. All right, the more they open up, the more they tell you, the better that you can take care of them. Patho. All right. So we have hypoalbuminemia. Surprise, surprise? Nah, at this point, everything's making sense. Subcutaneous fat, what about it? And muscle mass. Is that being degraded in kwashiorkor? No, it's spared. Integument. All right, these will be the manifestations. What do we see in the skin? All right, it's hypoalbuminemia. Hypoalbuminemia. It'll be flaky paint, and we'll see a picture of this. All right, the skin will look hyper and hypopigmented. Flag sign. That's in the hair. Once again, you'll see alterations in color of the hair. See pictures of that. Talked about the fatty liver. Well, it just got louder. Talked about the fatty liver. Why? Because you have loss of which particular protein? Apolipoproteins. You can't make the protein so that you can ship out the fat, and so your liver turns out to be extremely fatty. Immunity. What are immunoglobulins? What are they? Proteins. How about that? So if you don't have the proteins to make immunoglobulins, well, your immunity is compromised. GI. Don't worry about that so much. Bone marrow, hypoplastic. CNS, reduced number of neurons, impaired myelinization. All right, these are things that you would see systemically because you don't have the protein. Systemically, thymic, lymphoid atrophy, increased parasitic infections. And remember, just because you have kwashiorkor doesn't mean you are losing exclusively protein. You can also be deficient in other vitamins as well. Okay. Here's kwashiorkor. Big fat belly because this baby's being fed well. Quite the opposite, isn't it? What's going on? Edema and anasarca? Ascites? Well, I mean, what's in that region? Yeah, hepatomegaly, right? Here, exactly what's going on. That child on the left has a drawing. It's chalked out the actual hepatomegaly. Look how big that liver is. And then there's a mechanism on your bottom right as far as your apolipoprotein. So who's being blocked when you don't have the protein? Bam, gone. All right, so accumulation of fat. Any questions thus far? All right, so flag sign. Can't see it too well there, but there is discoloration of the hair. And because you don't have the protein, the hair is easily plucked. Are you guys paying attention? The hair is being easily plucked, and it's a flag sign. The hair is of discoloration, number one. The flaky paint, hypo and hyperpigmentation that you'll see. Okay. You also see the paint, or I'm sorry, not the paint, the skin, which is falling off. Okay. You have to be careful, though. Once again, like the gentleman asked me, so is it easy to figure it out? I mean, flaky paint doesn't necessarily mean that it's always kwashiorkor. You can have poor wound healing with vitamin K deficiency. You can have poor wound healing with vitamin C deficiency. So make sure that you take a history well. Is there a bat in the room? More kwashiorkor. Steatosis, fatty liver. Fatty liver. And how would you go about staining that? Do you remember that? Oil red, stuff like that. Sudan red. And then there's a summary of the body, schematically, as far as all the things that will take place. All right, so now let's go into vitamins. There's Mr. Funk, Casimir Funk. Initially thought that these were amines. Later came to find out they weren't amines, but still kept the name amines. Vita, with vitamin. Yeah, as you guys are right now. There's a lot of Vita out there right now. Wow, all right. Once again, just for your references, I don't mean to offend anyone. I actually saw this movie with Anita Ekberg, La Dolce Vita. Particularly for this lecture, it's amazing as to the things that you'll find as you're going about doing your research for medicine. And then, of course, there's Casimir Funk, and there's actually a band called the Vita Ruins. All right, so we'll go through vitamin A. This is important, all right? So we'll talk about fat. These are fat-soluble vitamins. We'll talk about the malabsorption, and when you lose each one of these vitamins, as to what will take place in the patient. Component of visual pigment, we'll see as to which one. There are 3 different forms of vitamin A. We'll go through that. We'll talk about epithelia, how important it is as far as maintenance of your epithelium. We'll talk about, resistant infection, one particular. Vitamin D, of course, intestinal absorption of both calcium and phosphate. We'll talk about how it goes about activating it. This you must have seen time and time again. This must be pretty much review. Correct. Vitamin E, a major antioxidant. Talk about this. It's antioxidant. What does that mean? It's going to pick up your ROS. What does ROS mean to anyone? Oh, I like that. Yes, I was going to stump someone, but that's not going to happen this morning. Reactive oxygen species was the answer. We'll see as to how vitamin E will protect you from that. Vitamin K. Vitamin K. You've heard this time and time again. Vitamin K dependent coagulation factors. What are they? 2, 7, 9, 10. We'll talk about gamma carboxylation. All right, I'm waking up. Fat soluble vitamins deficiency. If you don't have we'll talk about this. If you don't have the vitamin A, as to why you'll turn into a person who can't see in the dark. Squamous metaplasia. We'll see as to why you undergo squamous metaplasia. Important, people, important. Vulnerability infection. Well, that'll make sense. Vitamin D deficiency. As I said, certain deficiencies take place in children. Others will take place in adults. Rickets in children. Stimulation in adults. Vitamin E. If you don't have vitamin E. I've seen incredible pictures of this. I was excited to find vitamin E deficiency pictures. Vitamin K. Bleeding diatheses. Okay. Bleeding disorders, obviously. If you don't have vitamin K, your 2, 7, 9, 10 can't work. All right, so water-soluble vitamins. All right, so make sure that you know what the big picture is. Fat-soluble, what are they? A, D, E, K. All right, everything else will be your water-soluble. These are your B vitamins. Please make sure that you know. They will, they'll tell you as to what each one of these are, but it's easier if you just know what it is. So, for example, thiamine. All right, don't get that mixed up with thiamine in DNA, right? Right, don't get that mixed up. It's not the same thing at all. Which one's the Y? Where do you see the Y? In DNA. Yeah, exactly. THI is B1. All right, that's how you want to remember it. Simple stuff. B2, riboflavin. Pay attention to the F there. It's FAD. Where all do you see FAD? Where does FAD feed into? Nice. ETC, electron transport chain. I'm liking it. Then niacin, NAD, NADP, all that stuff. See that in the HMP shunt. Right, you see that in FAD, you see that in ETC as well. If you don't have that, then you have the 3 Ds. All right, deficiency, you have the 3 Ds, dementia, we'll talk about that, dermatitis, and diarrhea. B6, PLP, also known as help me out here. Thank you. All right. B12, all right, folate, DNA synthesis, vitamin C, talk about how it plays a role in